Are you aware of the potential danger lurking in your body? Are there signs your blood oxygen levels might be plummeting to unsafe levels, putting your health at risk? In this video, we'll delve into the alarming signs. You should never ignore those subtle hints that your body might be struggling with dangerously low blood oxygen levels. Stay informed and vigilant, as recognizing these indicators can be crucial in safeguarding your well-being. So let's uncover these essential warning signs and equip ourselves with the knowledge to protect our health. Number 6. Shortness of breath. When there is not enough oxygen in the blood, one of the most common symptoms is to have trouble breathing. The sensation that one cannot take a full breath or even catch one's breath is one of the hallmarks of this condition. A number of conditions, such as anxiety, asthma, allergies, pneumonia, COPD, or heart disease, can all contribute to a feeling of shortness of breath. If your body is not getting enough oxygen, your brain will send a signal to your respiratory system, telling it to speed up your breathing so that more oxygen may enter your body. On the other hand, if oxygen levels are too low, this response might not be able to adequately ease the feeling of being short of breath. It is essential to keep in mind that experiencing shortness of breath can also be a warning sign of a medical emergency, such as a heart attack, pulmonary embolism, or carbon monoxide poisoning. These are all very serious conditions. In the event that you encounter sudden or severe shortness of breath, it is imperative that you seek medical assistance as soon as possible. Number 5. Rapid breathing. Another common indicator of low oxygen levels in the blood is rapid breathing, which is also known as tachypnea. If your body is not getting enough oxygen, your respiratory system may try to make up for it by increasing the rate at which you breathe, which can lead to breaths that are short and shallow. This could give you a feeling of lightheadedness or dizziness. Anxiety, stress, asthma, pneumonia, or even a pulmonary embolism are just a few of the conditions that can lead to fast breathing. It is imperative that you get medical assistance if you experience difficulty catching your breath or realize that the rate at which you are breathing has significantly increased. The presence of rapid breathing may occasionally be an indication of a serious health problem, such as a heart attack or carbon monoxide poisoning. You should get immediate medical attention if you experience severe chest pain, shortness of breath, or difficulty breathing. The pain could come on suddenly. Number 4. Rapid heart rate. When there is not enough oxygen in the blood, one of the most common symptoms is tachycardia, which is a high heart rate. If your body is not getting enough oxygen, your heart may start pounding more quickly in order to pump more blood that is rich in oxygen to the organs. Anxiety, stress, dehydration, anemia, and cardiovascular disease are just a few of the conditions that might contribute to a high heart rate. It is imperative that you monitor your heart rate and seek medical assistance if you observe a large increase in it, or if you get the sensation that your heart is beating extremely fast. A quick heartbeat may in some instances be an indication of a medical emergency, such as a coronary attack or pulmonary embolism, for example. If you suddenly or severely develop chest tightness, shortness of breath, or a rapid heartbeat, you should seek medical assistance as soon as possible. Number 3. Confusion or disorientation. A lack of oxygen in the brain can impair cognitive function, which might result in confusion or disorientation. This can make it difficult for you to think clearly, concentrate, or recall things, and it may also make it more difficult for you to finish chores. A number of medical disorders, including pneumonia, heart failure, COPD, and sleep apnea, can bring on a state of confusion or disorientation. It is extremely important to be aware of any shifts in your mental state and to get medical assistance if you suffer any confusion or disorientation if these symptoms arise. Confusion and disorientation are symptoms that may appear in certain people who are experiencing a medical emergency, such as a stroke or carbon monoxide poisoning. If you suddenly or severely lose your bearings, you should seek medical assistance as soon as possible. In order for doctors to discover the source of your confusion or disorientation, they may undertake diagnostic procedures such as CT scans or MRI. Medication, oxygen therapy, or even just making some lifestyle adjustments like cutting back on stress can be effective forms of treatment. Number 2. Cyanosis. Cyanosis, often known as a bluish tint to the skin or lips, is a warning symptom that your blood may not be getting enough oxygen. Cyanosis is also known as cyanosis. This may take place if the blood veins in the body become constricted, or if there are problems with either the lungs or the heart. If you discover that your skin or lips have taken on a bluish tinge, you should visit a doctor as soon as possible because this could be an indication of a significant health problem. In order for doctors to discover the etiology of cyanosis, they may do tests such as arterial blood gas analysis or pulse oximetry. The use of oxygen therapy or medicine that improves blood flow are both potential treatment options. Number 1. Feelings of exhaustion or weakness. Weakness or exhaustion is another common symptom of having low levels of oxygen in the blood. When there is not enough oxygen in your body, your muscles can feel fatigued and weak, which can make it more difficult to participate in physically demanding tasks. There are a number of conditions, including anemia, heart disease, lung disease, and sleep apnea, that can bring on feelings of exhaustion or weakness. It is extremely important to monitor any shifts in your energy levels and to consult a doctor if you experience persistent feelings of weakness or exhaustion. Weakness or tiredness may in some instances be an indication of a medical emergency, such as a heart attack or pulmonary embolism, for example. If you suddenly feel extremely exhausted or weak, you should seek emergency medical assistance as soon as possible. Your physician may decide to perform tests such as blood tests, chest x-rays, or pulmonary function tests in order to determine the reason behind your feelings of weakness or exhaustion. Alterations to one's lifestyle, such as participating in more strenuous activities or securing adequate amounts of sleep, may also be considered as treatment alternatives along with the administration of prescribed medications and oxygen therapy. In conclusion, it is critical to your health and well-being that you are aware of the warning symptoms that indicate low oxygen levels in your blood. Significant warning signs that require immediate medical attention include shortness of breath, rapid breathing, high heart rate, confusion or disorientation, a bluish tint to the skin or lips, exhaustion or weakness, and a bluish tinge to the skin or lips. Knowledge is power. And now that you're armed with the crucial information about the 6 alarming signs of dangerously low blood oxygen levels, you can take charge of your health like never before. Remember, early detection and timely action can make all the difference in preventing potential health complications. Don't forget to like, subscribe, and turn on the notifications for our channel so you never miss what's coming next from us. Thanks for watching.